Now that we've looked at the synthesis of the nucleotides, what I'd like to focus in on is the degradation of the purines, because there is a disease that's associated with one of these particular, the purines rather than the pyrimidines. When you think about nucleotides, nucleotides are in the DNA. It is also part of so many cofactors that they are everywhere. And so when nucleotides undergo degradation, well, it happens all the time. And so to take care of the degradation, we first have to take off the phosphates. And so what we are going to do with the enzyme nucleotidase, we're going to remove the phosphates. So we can remove up to 3 of those, and it will hydrolyze nucleotides, those that have a base pair, a sugar, and phosphates, into nucleosides, those that have just a base pair and the sugar. The next removal or degradation, nucleoside pyrophosphorylase. Now we've seen phosphorylase before, but that was in the context of glycogen phosphorylase. Here, if you remember back to the mechanism, what we had was one PI come in as the attacking group, and the phosphate will allowed the removal of the sugar, one of the sugars, from the glycogen chain. Here we're going to do very similarly. The phosphorus is going to cleave the base away from the ribose, and what we will have is the ribose that is phosphorylated as the leaving group. Once we have the phosphorylase completed, the base pairs can be degraded, and then the ribose 1-phosphate can undergo reaction with the phospholipase mutase. And we're going to go from ribose 1-phosphate to ribose 5-phosphate. And so when we've seen the mutase before with the phosphos, we converted several of these, one in glycolysis, in which we started at the phosphate at the 3 position. We then moved it with a mutase to the 2 position. In the intermediate form, we had a 2,3 intermediate that was, we had bisphosphorylated intermediate. We also saw that particular mechanism when we looked at the conversion of glucose 1-phosphate to glucose 6-phosphate. It used a mutase. The intermediate is a 1,6-bis phosphate. And so you would assume that the mechanism would be very similar. The phosphate that's in the 1 position is not the phosphate that will be in the 5th position once we have gotten there. And so when you are here at the ribose 5-phosphate, you are in which of the pathways? I know that I've asked that several times. We are now in the pentose phosphate pathway. And for the degradative event, you will use transketolase, transaldolase to enter into glycolysis as the carbons are degraded. Now, the purine degradation, this is where we get an issue. And as we go through the degradation, what we're going to do is the base pairs without the sugar attached. And so GMP will be dephosphorylated by the nucleotidase. That was the first enzyme we looked at before. And then phosphorylase will give the free base. AMP actually undergoes a derivative of the base pair while it's still attached to the sugar. I will then dephosphorylate it, and then we will use the phosphorylase to remove the sugar, and we have a base pair, guanine and hypoxyxanthine. Now, in this, both will degrade in different ways, but we will create xanthine. Xanthine is then worked on by the enzyme xanthine oxidase, having molecular oxygen react. Peroxide will be the leaving group, and we will get what we know as urate or uric acid. pKa is 5.4, so it is in the deprotonated form, and this is what is excreted in the kidneys and placed into the urine. Now here's the problem. This particular structure is very insoluble. All right, and so if we have a lot of degradation going down coming from both pathways, we create this, and because it's insoluble, it will start to crystallize out. Now, what we're going to do to treat the disease that is caused by the crystal structures of this particular molecule, we're going to inhibit xanthine oxidase, which is common in this conversion, but if you actually look up here, xanthine oxidase also does this particular conversion from AMP. And so what we're going to do is we're going to use the drug allopurinol as the inhibitor. Now, this actually has a very high binding constant, but when the enzyme actually converts this base pair into this form, this becomes a suicide inhibitor. Now, most of the time we talk about a suicide inhibitor is one that will covalently link and not dissociate because it's actually connected. This becomes a suicide inhibitor because of how tightly it binds. It dissociates in the order or in the frame of a covalent bond just letting go. And so the binding is so tight, it acts like a covalent bond, thus it's a suicide inhibitor. Now, very low solubility, I create crystal structures. Now, I'll show you a picture of what that crystal structure looks like. It forms small needles, okay? Well, if you think about a crystal structure that is a needle inside the body, I'm not exactly sure where in the world you would like to have needles inside your body. Unfortunately, what happens is these needles crystallize and actually concentrate in the joints. And the joints are supposed to have cushion between the bones, but if you actually put needles inside the joints, you can have a lot of pain. Additionally, if these crystals go through the kidneys, which have very fine capillaries, the fact that they physically go through those very small blood vessels, we actually get physical damage, and so there's kidney damage for people who have the disease called gout. We believe it's genetic, but the biochemical cause for this is not elucidated, and the inherent what you would call, if a person came up with a symptom in a doctor's office that leads to gout, is joint pain, but particularly in the big toe. Don't know why, but the big toe seems to be very susceptible. Now, crystal needles in your big toe is very painful, and the pain that they experience or that they describe actually is to the level that they can't walk, many of these patients. And so treatment is the drug itself to inhibit the conversion to that final product, and also you degrade a lot of nucleotides by eating meat, animal meat, and so limiting intake of meat is also a treatment to this particular disease. Why in the world do we have urate even in the system? Well, urate actually has a very active antioxidant property. It's much better an antioxidant than a sorbate, so it can be used by certain systems to in an antioxidant as an antioxidant, and so the use of that actually tolerates the synthesis of this in the system, but its solubility is so low that you have the balance of this particular disease state. And so it's a risk reward. We tended to have some risk of the disease for the benefit of having the antioxidant in the system. All right, this concludes the amino acid and nitrogen chapter. Next time we'll be looking at integration of metabolism on a high, on kind of a very, very high level in terms of how all of this works.